annual event that is coming up 2 weeks from tomorrow. 2 weeks from tomorrow, it is going to be the Mid-Missouri Parkinson's Disease Patient and Caregiver Conference. One of the persons who is involved in that is in the studio with me, and it is Dr. Syed Shah. We welcome you. How are you today?
Good. Thanks for having me.
Let's talk about the Parkinson's disease. First of all, do you probably, as a physician with MU Healthcare, is this one of the things that you treat quite a bit of?
Yeah, I'm a neurologist by profession, and I'm being trained in movement disorder, and one of the movement disorder disease, one of the most common one is Parkinson's disease. So we deal a lot of Parkinson's disease patients.
I saw in material that was sent to me prior to this interview, 60,000 Americans are diagnosed each year with this.
That's correct. 60,000 people, 60 to 65,000 people actually are diagnosed every year. And around the globe, actually, there are 6 million people. In 1990, the number were 3 million. So it doubled in 25 years. And it is predicted that it will be doubled in 2040, so 13 million people would be affected with the disease.
So that leads me to have to ask the obvious question: Why is it becoming more prevalent?
So that's a very good question. One of the risk factors is age. One of the development that we made in the last century is that people are living longer. And when people are living longer, they will get something, and some neurodegenerative disease like Alzheimer's disease and Parkinson's disease. So age is one of the biggest risk factors. Second thing is industrial revolution, and in that, when we talk about it, is the pesticide, organic solvent, and metals. These are also risk factors for.
Help me understand that again. You said
pesticides, solvents, metals,
solvents, and things of that nature. So that would be that working with that, or would that be just out in the atmosphere?
So Parkinson's disease is still considered a disease of rural living.
Rural living,
and in industrialized nations. Farming is the one of the profession, and there is this association between pesticides and Parkinson's disease. So a lot of people they will come to us and they are like, I've been exposed to this, I've been exposed to this chemical, and what is there any link on the individual basis? It's very hard to identify that risk, but when it comes to population, there is a definite risk. And this association between Parkinson's disease and those chemical, pesticides, solvents.
From an agricultural background, they've been using that on their crops and on their fields.
That's correct.
That's interesting, but not everybody who works in that kind of an atmosphere gets Parkinson's disease. So are you trying to track down what is it that is in an individual that make them more likely to have Parkinson's disease?
That's a very good question. And then comes the genetic susceptibility also. People who are more susceptible. Age is another thing that comes into picture. And one of the research rightly said that genetic loads the guns, and environmental factors trigger it triggers the event then afterward.
Mm-hmm. We're talking with Dr. Syed Shah. He is going to be one of the presenters at the annual Mid-Missouri's Parkinson's Disease Patient and Caregiver Conference. It goes from 8 o'clock till 1:30, 8 a.m. to 1:30 p.m. on Saturday, September the 15th. Let's talk more about that for just a moment, and then I'll maybe come back with a couple of other questions in regard to Parkinson's disease. But tell me about the conference.
So actually, we are organizing this conference annually, and it's on September 15 this year. And I would urge everyone to sign up for this conference, because experts talk about the disease, and also patient comes and they share their thoughts, their questions, and spread the word out. That's the main thing about this conference, that we invite experts who talk about the disease.
You're going to have somebody who I've talked to regularly here, Joel Schenker, is going to be one of the doctors who's going to be presenting. He is with the neurosciences there and an associate professor, Department of Neurology. You also have someone from the MU Healthcare Family and Community Medicine, a clinical nurse specialist. You have another from urology. You're going to talk about that. And you are going to be one of the presenters, and you're an assistant professor from the Department of Neurology, as you said. And then Patsy Ponder Dalton, who many in this community from a while back will remember her, and she's co-facilitator of the Columbia Parkinsons Support Group and co-founder and a co-facilitator of the Lake of the Ozark Parkinsons Support Group. So you're bringing in people from a ways away and talk about these. What will you be saying in something that's titled My Parkinson's Disease?
So the main thing is when we say Parkinson's disease, a lot of patients, when you give them this diagnosis, David, it pierces the heart and drains the dream out of their lives. And there is so much misconceptions and myths about the disease. You ask the patient and they are, it's like Alzheimer's disease, it's like Lou Gehrig's disease, but it's not. You gave the example we were discussing, Alan Alda, and he's of the opinion also that it's a very livable condition, livable diagnosis. You can do all your chores, all your work, everything, but if you are put on the right track, and that's the role of a neurologist. So I'll talk about that. Not only that, but Parkinson's disease is it should have a multidisciplinary approach, and by that I mean not only doctor is involved, a lot of other people are involved in the care, like physical therapist, occupational therapist, speech therapist, swallow evaluation therapist, neurosurgeon, neuropsychologist, psychiatrist, caregivers, and a lot of other people. So, and we are providing all those services at MU Healthcare.
Is it physical therapy, occupational therapy? Is it therapy that helps people deal with it, or is it medication that helps people deal with it, or combination?
All of these. And it is the role of a neurologist to individualize the therapies towards the individual need and the patient needs. And this is what we do. And
you mentioned Alan Alda. He's probably the most recent, highly noted celebrity that has come out and said that he has Parkinson's disease. He's in an advanced age. We think of Michael J. Fox, who was very young when he talked about it. So I guess, as you said, it might be happening more often now because we are living longer. But again, it does strike people who are young at times.
Yeah, 10 to 15% of patients they have the genetic mutation. That's what we have found so far. And if the patient developed the disease 40s, in their 30s and 40s, we are wondering, and we are then debating if genetics are involved. But usually the median age is 60, 70. So
you think Parkinson's disease will be I almost said solved, I should say cured someday?
Hope should be alive, and there have been a lot of researches going on. So far, we do not have a cure for the disease, but we can make. We have a lot of therapies, medication, and surgical options that we can make a big difference in patient life.
Patients and caregivers should take note and attend the Mid-Missouri Parkinson's Disease Patient and Caregiver Conference. Again, it is scheduled for 8 o'clock beginning on September the 15th. That is 2 weeks from tomorrow. Need to sign up ahead of time, correct, Doctor?
That's correct.
So the way to do that would be to contact MU Healthcare. Contact me. I can get you registration information also. You need to email Penny McQueen at health.missouri.edu. But let me know if you would like more information. If you cannot find that through your physician or through MU Healthcare contacts, and we will make sure that you get what you need to know to be able to register to take part in this conference, which comes up on the 15th. Doctor, thank you. Appreciate you being here.
Thanks for having me.
Dr. Syed Shah has been our guest from MU Healthcare. You're listening to News Talk 1400 KFRU.